Assalamu alaikum and welcome to today's lecture in medical research. One of the biggest challenges students and researchers face is choosing the correct statistical test. The decision often depends on the study hypothesis, types of variables, distribution of data, number of groups, whether the data are paired or unpaired, and study design. In this video, I will guide you through a simple and step-by-step practical decision-making flowchart that will help you instantly select the correct statistical test for your analysis. If our objective is predicting of an outcome, step 6. For continuous normal data, predicting a continuous outcome, for example, adults BMI. Multiple predictors use multiple linear regression analysis. For example, predicting cardiovascular risk factors, dependent variables, adult BMI, independent variables, age, height, weight circumference, pulse, diastolic blood pressure, systolic blood pressure, cholesterol levels. Goal: identify key risk factors for cardiovascular issues. Results: the model identifies significant predictors showing how changes in blood pressure or waist size relate to BMI, even when considering multiple factors simultaneously. For binary categorical data, predicting a binary outcome, heart disease, yes and no. Multiple predictors use multiple logistic regression analysis, predicting heart disease risk. For example, predicting heart disease risk. Outcome variable heart disease 1 yes, 0 no. Predictors age, sex, smoking status, and body mass index. Model output. The model calculates the probability that a patient has heart disease given their specific age, sex, smoking status, and BMI. Interpretation: an odds ratio might show that for very one unit increases in age, the odds of having heart disease increases 1.05, meaning a 5% increases in odds. For ordinal categorical data, ordinal outcome dependent variable has three or more ordered categories, for example, BMI, underweight, normal, overweight, obese. Predict ordinal outcome. Multiple predictors use multiple ordinal regression analysis. Ordinal regression predicting post-operative pain severity. A study investigates factors that influence the severity of post-operative pain after a surgical procedure. The dependent variable is post-operative pain severity, which is an ordinal, ordered multi-category variable with possible outcomes: mild, moderate, severe. Researchers use patient characteristics and surgical parameters as independent variable to predict the severity of pain. Independent variables: surgical segment, anesthesia method, complication rate, and age group. How ordinal categorical variables are used. The model estimates the effects of each independent variable on the cumulative odds being in a higher pain category. moderate or severe ways, mild mild or moderate. The analysis found that specific factors such as higher intraoperative blood loss increases the odds of the developing a worse severity of illness across all cut points of the pain scale. The model assumes the effect of each predictor is consistent across these different cut points. The proportional odds assumption used for multiple categorical data. Multinomial outcome dependent variable has three or more unordered categories: chest pain, typical angina, atypical angina, non-anginal pain, asymptomatic. Predict multinomial outcome. Multiple predictors use multiple multinomial regression analysis. For example, a study aims to identify the factors associated with different types of chest pain in patients. The dependent variable is chest pain type, which is a nominal, unordered multi-category variables with possible outcome. How multi-categorical variables are used. Researchers want to use how several independent variables predict the odds of being in one pain category relatively to the reference category. Age, sex, fasting blood sugar, exercise included, angina, thalamic, heart rate achieved, which can be categorized into levels like less than 100, 100 to 150 and greater than 150 bpm. The model estimates the odds ratio for each independent variable category relative to its own reference category for each outcome category versus the baseline outcome category. The analysis might show that a high maximum heart rate greater than 150 bpm significantly increases the odds of having typical angina compared to being asymptomatic while controlling for other factors. Quantile regression analysis. Quantile regression is used widely in health sciences to understand how the effect of risk factors vary across the entire distribution of health outcomes rather than just the average mean. This is particularly useful for skewed data such as air pollution exposure, healthcare cost, or length of hospital stay. For continuous skewed data, continuous outcome, maternal air pollution exposure, and infants' birth weight predict continuous outcome with skewed data. Multiple predictors use multiple quantile regression analysis. For example, maternal and child health, air pollution, and birth weight study. This method was applied to examine the association between parental air pollution exposure and an infant's birth weight distribution. Key finding association between air pollution and of reduced birth weight were of a greater magnitude at the lower quantile of birth weight. This implies that the most vulnerable infants are disproportionately affected by air pollution, providing crucial insight for targeted public health interventions. For count data, the outcome is count child mortality, predict count outcome. Multiple predictors use multiple Poisson regression analysis. Multiple use multiple Poisson regression analysis. For example, outcome number of under 5 child deaths per mother. Predictors factors like maternal education, immunization status, and nutritional status. For time to event survival data, outcome use different tests, Kaplan-Meier curve, log rank test. If we have several predictors, we multiple use Cox proportional hazard regression analysis. Example, new heart medication. Goal, a new drug age and gender affect the time until a heart attack data. Age, gender, patient data includes times to events, months, years, censoring status, date, and censored and drug group, treatment and control group. Cox proportionals hazards regression. Example, results and interpretations. Drug treatment based controls. Hazard ratio is equal to zero point 0.7. Patients on the new drug have a 30% lower hazard of the heart attack at any given time compared to the control group. Age continuous hazard ratio 1.2. For every 1 year increase in age, the risk of heart attack increases by a factor of 1.2, assuming other factors are constant. Gender hazard ratio is equal to zero point 0.4. When have a 60% lower risk of a heart attack compared to men holding age and treatment constant. Key concept in the examples. Key concept in the example hazard ratio, the ratio of hazard between groups and greater than 1 increases risk, less than 1 decreases risk, 1 no effect or no risk. Proportional hazards. The ratio of the hazards between groups remain constant over time. The drug protective effects does not dramatically change after 1 year with 5 years. Censoring. The model handles situations when patients leave the study or the study end before the event occur, providing valuable insights. Step 7. Flowchart summary. Final flowchart. Is the outcome numerical or categorical? If numerical, check normality. How many groups? Is sampling paired or independent? Select the appropriate test from t-test. One sample paired independent. ANOVA, Kurzweil-Wallis test, chi-square Fisher exact test, Mann-Whitney or Wilcoxon. If we want to predict an outcome, use different regression models. Conclusion. Final message. Choosing the right statistical test becomes easy if you follow a structured flowchart. Once you understand your variable distribution groups and the study design, the correct test becomes clear. Thank you for watching. Don't forget to like, subscribe and share this lecture.